The second one is looking at chronic infections. And
Mm.
these can be viral infections, they can be bacterial infections, they can be fungal infections, they can be any kind of infection. We have this whole biome that we share. There are more cells that aren't us than are us in our body. And we have a whole host of viruses that are living in us, and they can get reactivated. Many of these are opportunistic. And if we just talk about the viruses, there are some classic ones that we know, like Epstein-Barr virus, HHV6. A lot of these are in the herpes family, the cytomegalovirus. There's also parvo B virus. There are a lot of different viruses that can lie dormant and get reactivated under times of stress. And again, like I mentioned earlier, the motor vehicle accident, the challenging childbirth, the divorce, any of those kinds of stresses can reactivate it. And my experience with viral infections in particular, and these are some of the things I listen for, and I think if you have clinicians listening here, it's often stuff that people are too either dismiss or they're too afraid to tell somebody because they think they're going to think they're crazy. And that's some of the weird stuff are symptoms that come and go, like at certain times, I had
Mm.
one patient who had felt like she had the flu after orgasm. I would suspect that that was a viral infection that was kind of flaring after she had a big energy release. Things that impact the nerves, like tingling. I feel like there are things crawling on my skin, but I look and there's nothing there. Sharp wandering nerve pains. That can also be a Lyme
Mm.
infection, but it can be also be a different kind of viral infection because the viruses tend to like to get into the nerves. Sometimes the low-grade infections, women in our vaginal vault can hold low-grade infections that can really exhaust us. We can have low-grade infections in our mouth and our teeth and in our gums and in our sinuses that can impact and kind of wear down the immune system or make it hyperreactive. And if you have one of those low-grade infections, it's sort of this, I find that people often feel it's like this heavy tiredness most of the time, if not all the time. It's kind of like you're like dragging, like walking through molasses. Like I remember patients say, it was like I'm walking across the parking lot and it's like I'm walking through molasses. That heavy, heavy feeling in your
Yeah.
body and heavy in the limbs, like the legs feeling really heavy. Like that's a classic sign for a lot of patients of the Epstein-Barr virus or one of the viruses.
So, Dr. Jenny, would you say if people feel flu-like, they have maybe the swollen lymph glands, they're achy, the low-grade fever, that would go with this category?
100%. Yes,
Okay.
definitely. Those swollen glands that come and go. I
Yeah.
wake up every morning with that little sore throat.
Oh,
I
yes.
always, and also, and a lot of these people either never get sick because their immune system is so suppressed it's hardly reacting, or they catch every single thing that comes through the room.
Yeah.
The like kids come over for just a couple hours, they walk through the grocery store or whatever, they catch everything all the time. So it's either one of those two pictures. But yes,
Okay.
those are classic